Have you ever heard about cirrhosis? Or do you know about cirrhosis? Hi, my name is Morena Turnip. Currently, I am a student at Hunter College, majoring public health and taking public health biology class. In this presentation, I would be presenting topic cirrhosis. For a disclaimer, most of the information that I present in this video is a research base, and I attach the resources at the end of the presentation. In this presentation, I will cover definitions of cirrhosis, facts and concerns about cirrhosis, what causes cirrhosis, symptoms of cirrhosis, stages of cirrhosis, diagnosis of cirrhosis, treatment of cirrhosis, prevention of cirrhosis, mortality map of cirrhosis by states in the US, important things to consider about cirrhosis, and references. Now you may wonder, what is cirrhosis? According to National Institutions of Health, cirrhosis is a form of chronic liver disease in which the liver slowly deteriorates and malfunction due to chronic injury. It's often an irreversible scarring of the liver and can create a permanent loss of liver. So as you can see in this image, these are how our healthy livers looks like, and this is the cirrhosis liver looks like. So there will be stages between these two where you're still able to go back to your healthy liver, but once it gets to cirrhosis, you cannot really go back to the healthy liver stage. There's a fact and concern of cirrhosis that we need to be aware of. In 2010, cirrhosis was the 12th leading cause of mortality worldwide, responsible for killing about 1 million deaths. And similarly, in the United States, it is also the 12th leading cause of mortality, responsible for 31,903 deaths and representing 3.3% increase in age-adjusted death since 2009. And furthermore, according to CDC, as of 2022, there are 4.5 million people in the United States with liver disease and 51,642 deaths per 100,000 population. Now, a study been finding that most people with cirrhosis are undiagnosed, which should be a concern for everyone. What causes cirrhosis? In the United States, long-term alcoholism is the primary cause of cirrhosis, followed by obesity. However, causes of cirrhosis varies geographically. For example, in Western countries, alcoholism is one of the causes of cirrhosis, followed by chronic hepatitis C virus infections, and non-alcoholic fatty liver disease is the most common cause of cirrhosis as well. But differently, in Asian Pacific region, chronic hepatitis B is the primary cause of liver cirrhosis. And most people with cirrhosis have multiple causes of liver damage. It takes years of chronic injury to cause cirrhosis. There's other factor that causes cirrhosis, such as a risk factor for hepatitis B and C viruses. It is including history of blood transfusion, surgery, tattooing, dialysis, needle stick injuries, and sexual contact. And more hepatitis D, autoimmune hepatitis, alcohol-related liver disease, drugs, toxins, infections, and disease that damage or destroy bile duct. Liver cirrhosis also has many other causes such as heritage diseases, hemochromatosis and Wilson disease, primary biliary cirrhosis, primary sclerosing cholangitis, and autoimmune hepatitis. Now, if we talk about symptoms of cirrhosis, there will be a lot of symptoms, and let's begin with the image right here. A person with cirrhosis might show symptoms of red palms and a building fluid in the stomach or ascites, widened blood vessels. So you can see all the blood vessels are shown, muscle wasting, lack of body hair, spider agioma, confusion, and jaundice or yellow skin and eyes. But also symptoms of cirrhosis are usually caused by the loss of functions with the liver cell or scarring cells that leads to swelling. And then as a result, a person will have constipations, abdominal pain, diarrhea, nausea, fatigue, vomiting, ingestions, weight loss, weakness, itching, bleeding gums, fever, fluid in the lungs, musty breath, neuritis, slurred speech, tremors, and other mixed symptoms such as anemia. And in addition to that, symptoms may present if the liver loses its ability to remove toxin from the brain. Cirrhosis is a progressive disease, and the symptoms becomes more severe and may escalate over time. So now that we see all these symptoms, we might think there's a lot of symptoms, but most of the time people don't actually shows exactly the same symptoms or maybe lack of one of the symptoms, which make it difficult to diagnose actually. Now there is 4 stages of cirrhosis. So for example, in this image, you can see how our healthy liver is they put it as the first stage because it makes sense, where that's where all begins, where your healthy livers, and then it develops to fatty livers, and then fibrosis of liver, and lastly the cirrhosis of liver. Say for example, in alcoholic cirrhosis, then you will have alcoholic fatty liver in this stage, where fat accumulates in the liver, causing the liver to enlarge, appearing yellow and greasy. But at this point, it's still possible for the patient's liver to recover if the alcohol drinking habit ceases, which then the person still can go back to a healthy liver stage. But if it's not taken seriously, progress to hepatitis or inflammations of the liver will continue, and this acute alcohol hepatitis also progress to cirrhosis is when the fibrous tissue and fat is accumulating or projected. So then the person would be in the 3rd stage of fibrosis of liver. Then if it's still not taken care of, then a person will end up in cirrhosis liver, where the liver corrupts and die, leading to formations of nodules in the liver, and eventually the liver will shrink. And these are the stage where it is irreversible. Now, diagnosis of cirrhosis can be a bit difficult. As we spoke before, there's a lot of symptoms that are accountable for cirrhosis, but not everyone may present the same, and every level is different. So, a practitioner may examine the symptoms and then continue by physical examinations, by looking into Fulmer erythema, vascular spider, and abdominal collateral. Then it may follow by laboratory tests, imaging by performing ultrasound, order a CT scan once the cirrhosis is suspected during the ultrasound stage. And doctor will also may use coumadin to see a sensitivity to anticoagulant as the effect of the coumadin. And lastly is through liver biopsy. But all of this diagnosis actually cannot be independently diagnosed cirrhosis. It sort of supported each other's claim. So most of doctor will provide maybe 2 or 3 of these diagnosed for persons to be diagnosed cirrhosis. The treatment of cirrhosis can be also varies. It depends on the stage or the complications and what causes the disease. Because cirrhosis is chronic disease and one of the last stage is irreversible, mostly the treatment is slowly just to slow progressions of the scar tissue, comfort or treat the complications, and prevent the disease. But in addition to that, a doctor may prescribe drugs such as pain control, iron supplement, fluid restorations, laxative, vasoconstrictor to stop internal bleeding, beta blocker to control cirrhosis portal hypertension, antiemetic to control nausea, non-steroid anti-inflammatory drugs, acetaminophen, and hepatotoxin. But in addition to that, there is time that the person may actually be prescribed with nephrotoxin. It depends on what causes the cirrhosis. And the next treatment, usually someone may go through surgery, but in the surgery, it's done under special surgical procedure. For example, doing the balloon tamponade ligations to stop the bleeding of varices in the stomach. And most importantly, often the treatment is through a lifestyle by avoiding alcohol and other substances, and as well as nutritious diet to support the liver and for it to not getting worse. But in addition to that, the doctor may also prescribe lactulose to clean the bowel in the hepatic and hepatovaly, and antibiotic. When it comes to cirrhosis, since it's a chronic disease, prevention is very important. And the most crucial way to prevent cirrhosis is through healthy lifestyle by avoiding or maintaining low alcohol consumptions and other substances, maintain healthy weight, decrease salt intake, exercise, and increase adequate mineral water intakes. As we previously talked, that hepatitis B, C, and D is one of the cause of cirrhosis. It's important for us to reduce the risk of developing hepatitis B, C, and D. And the most important thing is population screening. As in the beginning, I talked about the fact that most people are actually undiagnosed. So it's important for us to catch cirrhosis or maybe the stage of fatty liver where we still can go back to a healthy liver stage. So it's crucial for people to go screening. And particularly for people who are diagnosed with fatty liver, alcohol and other substances should be or must be avoided. And lastly, through nutritionist diet. Now there is this interesting map of cirrhosis where we can see it's interesting how New Mexico actually have the highest mortality rate for cirrhosis, which is about 28.32 to 33.4. And that's as of 2020 because that was the latest data I can find. And then followed by Wyoming and South Dakota, which is 23.24 to 28.32, then followed by Montana and Alaska. Then the rest of the state kind of have similar, but the lowest is 8 below 13.8, which is I'm surprised actually New York in that state, given that if we think about cities, there's a lot of people who actually drinks. But this is a fascinating map. Now, this is important for us to consider when it comes to cirrhosis. Cirrhosis is a chronic disease, and many people who have cirrhosis remain undiagnosed, which should be a concern for everyone. Primary preventions is always better than secondary preventions, as well as tertiary preventions. People with hepatitis B, C, and D, or other risk factor in developing cirrhosis should consider for screening. And lastly, the most important thing, healthy lifestyle for healthy liver. Thank you for your attention, and I hope these presentations will make you think about which one is better, prevention or treatment when it comes to cirrhosis. And I hope you're getting some really interesting fact about cirrhosis for a healthy lifestyle. Love your liver, healthy liver for a better life. Thank you.